Imagine spending a few days on the sugar white sands of the Gulf Coast with your family while attending an ultrasound-guided regional anesthesia preceptorship program at the prestigious Andrews Institute. Featuring renowned orthopedic surgeon Dr. James Andrews, the Andrews Institute attracts athletes from around the globe, from established NFL, NBA, and MLB professionals to little leaguers who dream of making it in the big leagues. This unique program offers you the opportunity to learn and observe ultrasound-guided regional anesthesia techniques with a hands-on 2-day experience. Immerse yourself in a high-volume orthopedic ambulatory surgery center alongside Andrews Institute's medical director, Dr. Gregory Hickman, and Andrews Institute's Regional Anesthesia Fellowship Director, Dr. Brandon Winchester. Dr. Hickman will share his first-hand knowledge learned from over 21 years of regional anesthesia experience. And Dr. Winchester will demonstrate a broad array of regional anesthesia techniques developed during his years on faculty at Duke University Medical Center.
There's a lot of reasons why Dr. Hickman and myself created the ultrasound-guided regional anesthesia preceptorship at Andrews Institute. Greg and I teach regional anesthesia courses on a regular basis. This is so much more than anyone could get in a 1 or even a 2-day seminar. When physicians and nurses come to the ultrasound-guided preceptorship here at Andrews Institute, they're able to watch the procedure, interact with us in real time, ask a question when they have it, and get an answer right away. It's a high-volume, high-activity experience. So if your goal is to make an impact on your own practice in a very short period of time, this is the place to do it. At our preceptorship, you get the best of both worlds. Top world-class education, followed by incredible resort-like destination in the same town. So if you're interested in attending our preceptorship and want to learn more, I encourage you to take a look at our brochure. I encourage you to find out more about the Gulf Coast and what it has to offer as a destination. And I think that once you've reviewed this information, you'll definitely want to come join us here for a couple of days.
The goals of the preceptorship include improved understanding of the literature with didactics, reviewing ultrasound basics, peripheral vascular and neurocyanoanatomy, and specific ultrasound-guided regional blocks. Observation at a high-volume regional anesthesia center of excellence, with daily ultrasound-guided blocks performed including interscalene, supraclavicular, infraclavicular, axillary, femoral, popliteal, saphenous, and TAP. Additionally, practical exposure to a highly efficient sports medicine private practice at a world-class ASC on the beach, with an attendee comprehensive guide which includes regional anesthesia protocols, multimodal analgesia regimens, documentation, and billing. And finally, hands-on experience scanning live volunteers and practicing needle insertion on inorganic models with a 1-to-1 pupil to instructor ratio.
I would recommend that anyone come down here, not just because of the large volume of cases and catheters that you'll have exposure to, but this is far better than a 2-day seminar. It's a smaller, more intimate setting. You're actually seeing it in practice. You're asking the questions as the procedure is taking place, and it helps to reaffirm the information that you're learning here.
I would definitely recommend it to a friend or colleague because I can't imagine how we can get more information packed into 1 day or 2 days if you're here for 2 days. Being here in person is extremely valuable. You get one-on-one with the physicians that are here doing the blocks, instantaneous feedback, any questions you have, they answer immediately. The volume of cases and just being able to do so many in 1 day and get that kind of exposure to pretty much every single block. And it's a great approach to be able to start at ground level and work this into your own practice and facility.
Well, I think this is really a great institution to learn. It's almost like hands-on approach without actually touching. You can see how Dr. Hickman and Dr. Winchester approach the patients, how they talk, how they educate. The educational piece is great, and you see their techniques compared to your own. There is definitely a big plus to having doctors available to discuss their technique, their experience, and introduce it to my own practice.
While you advance your career, your family can enjoy a few days of relaxation on beautiful Pensacola Beach. This family-friendly destination offers a vacation experience for all ages. During the evenings, enjoy dinners at a wide variety of restaurants from beach casual to fine dining. When your training is through, spend a few extra days of well-earned relaxation time on the beach. Hotel and condominium packages are available. Preceptorships are limited to 3 doctors per 2-day session.
I truly enjoy having the one-on-one interaction or one-on-two interaction, and for people to come visit us and see how we do it and actually teach them some of the tricks that we've learned over the years of using ultrasound and doing over 200 blocks a month. Not only is the Andrews Institute known for Dr. Jim Andrews and all the professional athletes that he's treated from all over the world and the high quality of medical care we have here, but you can have a wonderful time here on Pensacola Beach while improving your education at this facility.
This is an opportunity for you and your family to enjoy a world-class vacation destination while improving your regional anesthesia skills and meeting CME requirements. So what are you waiting for? To find out more, contact Dr. Winchester today.